also discussed, yes, we also discussed how agenda is put into policy. So what are the dimensions, like how there is an agenda, how that will be put into policy. But now policy is in place. Just imagine now that after a lot of things which happened, which some of you might be aware about, some of the things you might not be aware about, but now policy is on the ground. What are the challenges now? Because in every country, we have been listening, or we have been seeing in India as well, that there are very good policies, very good policy documents. But when it comes to implementation, there are multiple challenges. I just take you example of tobacco control. We have a very good act, Tobacco Control Act, Cigarette and Other Tobacco Product Act, very wonderful act. Lot of penalties, lot of things are there into it. We have a national tobacco control program as well. But when it comes to implementation, there are multiple challenges for its implementation. Right? Like for example, some people, there is no workforce to actually see whether the things are being implemented on the ground. There are not enough resources. Resources are competing with each other. People say, we are more worried about immediate deaths, which are happening due to non-vaccine. We are 20 years due to tobacco use, right? So that is why the focus of resources are shifted to some other prior policies, right? So there are multiple other challenges as well. Multi-sectoral coordination. Health want to do it. Taxation, I discussed last time as well. 13 ministries are involved. Taxation doesn't want to do it, or the other agriculture ministry doesn't want to do it. Labor ministry doesn't want to do it. So there is a lot of competition, right? So that is what we will hear here in this presentation about the policy implementation, what it is, what are the various factors affecting policy implementation, and various approaches to policy implementation. Now you can just think on imagining the policy which you are working upon, the national health policy. What approach do you think is working in your country? Right? I will give you 4 approaches today, and you can just think on that this might be the possible approach which is working in my country. Right? When it comes to policy implementation, so policy implementation is what? Converting the intended outcome of a given policy into action. Whatever we have written in that very beautiful document, right? These are our intended outcomes, or these are our objectives which we want to achieve. How to convert them into real action on the ground. That is what policy implementation is, right? Process of turning policy into practice, exactly like this, or involves administrative procedures, rule making, resource allocation, service delivery. All these things are really important. You have a policy, but you don't have policy guidelines. I told you about in my first lecture. You have a beautiful policy. We have a beautiful policy of Article 5.3 of Framework Convention on Tobacco Control. What is 5.3? It is we can't work with tobacco industry. That is Article 5.3 in simple language. Because tobacco industry have their own profits, they can't, so we can't associate with them. Right? So various states or various provinces have very good Article 5.3 policies, but they don't have implementation guidelines. How to actually go ahead? And everyone is thinking, yes, there is a policy, how to go ahead, because we don't know how to actually go ahead with it. So policy should have some policy guidelines along with it. This is number 1, which is important, right? Some rules of implementation. Resource allocation. You have policy, but you don't have resources to actually implement that. Right? That is really important. And then service delivery. How to actually implement this into the overall health system. Because health system is broad. How to put that into health system. It's a complex process, and again often a political process. So some people, I don't know how many of you have read that book. There is a book known as Policy is Politics. Right? So this is, I think this is what people say. This policy is politics. What do you mean by this? And a very nice book it is written. I don't know, I read it, something like that, something related to it. But when you actually go into the ground, when I was a student, I was thinking, why policy is process? Policy is a very good document prepared by academicians like us. How it can be a politics? Politics is something like that which we are not, which we are away with. They are working somewhere else. But then I came to know when working on the ground that when it comes to implementation or even agenda setting, policy is really a politics. They play a very important key role on. So that is what, that it's a political process, right? Where various actors influence both the direction and execution of policy, even the direction of the policy, interpretation of the policy, right? So now, why there is a need for policy implementation? Because the way I said, there is always a implementation gap. There are policy expectations, which is written in the policy document, and there are ground reality, which is there on the ground. There is always a gap. There are policy goals, actual impact, there is a gap. We want to fill that gap. If we are working effectively in implementation, this gap will be narrowed. This is the second challenge which we face. First challenge which we face is effective policy making. The second challenge which we face is effective policy implementation. Right? So these are the things which we need to do, and this I already told you, translating policy into action and shapes objective into enforceable rules, facilitate feedback-driven improvements, define roles, metrics and accountability of people, and adapt strategies to local contexts. All these things are really important when it comes to execution of the policy. Right? Now, I think this is not a new thing for you now. These we have been hearing this policy triangle for last 3 days. But what I wanted to make is I have put some of the factors influencing policy implementation in all these 4 factors. Number 1, for example, is the context. If there is a complexity of administration, like for example, one policy is being influenced by different departments. FCTC, again the same, not health, 13 departments. If there is no coordination between those departments, this remains policy of the paper. So complexity of administration, if there is only one department to administer, then it is simple. The second thing is socio-economic conditions. Some policies are influenced by our socio-economic condition. If we have poor economy of the country, some policy requires a lot of resources. You will not get it. People will say, oh, keep this in abeyance. We have not many other issues to do. We have poverty, we have hunger, we have HIV/AIDS, we have a lot of other things. Tobacco, no. Right, so these are factors. Then international dynamics. I think last session on this, we want to get, I think very good example by my friend here, that these drugs are there, they are happening well on the ground, but the international people are saying that they are not working, you need to work on others. Right, and then where the money comes, let us do it. Right, this is what the approach of the government is. Let us do it. So that is why now various countries are getting rid of these things. They are developing their own, like for example India, for last now over 10 years under the current administration, they are not taking any USA, they have banned, like even before the Trump era came, that Trump said that we don't want USA to work on. Our country has already reducing the number of NGOs which are working in our country. Why? Because some of the NGOs were actually dictating the policies. So they are already, our Prime Minister has already started reducing the number of NGOs, only select NGO, and again, NGOs are being told now that you need to give the funds to a common exchequer. Like for example, if the UNICEF is working or so, and it is up to the country to actually drive that particular fund into different policies which are important for the country. So now it is coming up. Now it is coming up in some countries, right? So this is happening now. I'm not 100% sure that it is 100% working, but yes, I have seen over a period of time that it is working to a certain extent. Yes, I think it's not working. Yeah.
All right. Thank you, sir. I want to comment on the fact that you say in India.
Started thinking because the economy has become stronger. But again, with economy, the thinking of the administration, thinking of the Prime Minister, thinking of our legislator has been like that. So this adds to what you are saying about the growing economy, right? The second thing is about the process, implementation part of the process. So again, the content, that source of the policy and the policy clarity. If we have good clarity of the policy, then there is less problem. But if the policy is very complexly written, everybody interprets on their own, then you are bound to have difficulty in implementing that policy. If everybody has their own interpretation about what is written. So that is why the policy clarity is really important when we are drafting that policy. And if you have seen that 10 things which I have written in my previous lecture about what should be the policy, it should be clear, concise, comprehensive. Right? So clarity is really very important when you are drafting. Clarity means, like if you are reading that policy, you are reading that policy, you are reading that policy, everything, interpretation should be same. Yeah. So that is what is there. Now, I'm coming to those approaches which I was talking about. Right? Just keep on imagining about your policy which you have been working and the approach which I have been talking about. Right? These are the four approaches: top-down, bottom-up, principal agent theory, and new public management. These are the four approaches. The first approach is the top-down approach. What exactly? You know about top-down, right? So here, the theory envisioning a clear division between formulation and implementation. What does that mean? There is a clear division between policy formulation and implementation, where subordinate level linearly and rationally put into practice the intentions of higher levels. Very clear. Which type of system I am talking about? Which type of system? I talked to you about presidential system, I talked to you about federal system, parliamentary system. Okay. So can you explain? There is a clear division between policy formulation and implementation, and that means the subordinate level linearly and rationally put into practice intentions of higher level. So there is a higher authority issue directives. So it is basically the higher authorities are issuing the directive, and whatever thing the lower authority need to do, the higher authorities are dictating it. So that means the states are dependent upon the orders, or the provinces are depending upon the orders which the central government is giving to them. Right? So it's a top-down. It's a centralized decision making. The people who are at the top. You have some? Yeah.
No, fine. I was saying politics is politics. all this engages all the people who are
Yeah.
for instance.
So, but the only thing is, that is there in the entire policy. But here, in the top-down approach, where the top-level people who are at the central people, the one person or one party at the central level are dictating everything what the state should do. If you want to immunize, you have to immunize everyone in the state. Right? It's not federal. It's totally dictating it's something related to what we discussed about the unitary or the presidential system, where there is a uniform policy, procedures and enforcement. But here, this is also successful in some countries. Because, why? Because there is a uniform policy everywhere, the same type of things are being said. Only where this is implemented is successful, only where, just few places or few contexts, where the problem remains the same across the states. If the problem is same, then it is better to have a uniform policy which comes from the top and which is implemented on the ground. But if the problem of different states are different, if states have different problems, the central have different thinking process, then what should be then it should be the bottoms up approach. Are you with me?
Yes.
Yes.
Right.